I want to thank NCCI for giving me an opportunity to talk to you about this a little bit. You know, there are so many potential medical advances that it's possible to talk about that affect workers' compensation that I was initially a little surprised that they had selected medical marijuana for today's program. But I've learned today that this is the Woodstock of the insurance industry. So it all becomes clear. So thank you. So hopefully we'll be able to have some fun here and enlighten you a little bit about some things that are going on. But before we get to the tantalizing prospect of what effect marijuana might have on opioids, let's back up a little bit and talk about medical marijuana, you know, in a broader perspective. Does it actually do anything? So we'll look at a little bit of the evidence for that. We certainly want to focus on the workplace issues and what ramifications that's going to have for employers and insurers. We'll come back to opioids and talk about that a little bit, and then talk a little bit about where the public policy around marijuana is likely to go over the next few years. Not that I really have a clue. I think that one can think about this, if you want to oversimplify a little bit, from two different perspectives. One, which I might characterize as the current Department of Justice approach, is that marijuana has minimal to no medical value, and it's just a bunch of people who want to get high. Well, okay, there is also an opposite approach that you might think of as maybe the Dr. Oz, Gwyneth Paltrow approach, that this is a wonder drug that's good for anything, and it's got no side effects, and we should all be taking some. Not surprisingly, I don't think either of these is actually the accurate perspective, and hopefully we'll try to sort that out a bit. So we have to do a little science. I'm sorry about that, but we have to talk about some specifics here. When we say marijuana, we are actually talking about two different species of plants. And those of you who live in states where you can go into dispensaries will see that there are sometimes strains that are labeled sativa strains or indica strains, and that's what they're talking about. But these things have been so interbred that it probably doesn't really form a meaningful distinction anymore. But when we say cannabis, that term applies to both of these plants. And all of these strains of marijuana have in common that they have two principal chemical components, tetrahydrocannabinol, or THC, and cannabidiol, CBD. And these are the two most medically important components of all of the cannabis plants that one can buy on the market right now. Now, it's also important to recognize that these two drugs, which are referred to as cannabinoids, represent, while they are the most biologically active cannabinoids, they are by no means the whole story. There are literally hundreds of other organic substances within the plant, some of which are cannabinoids, some of which are not. I think the simple statement about it is that we don't really have a clue how important they might be with some of the biological effects, or to what extent they might modify the effects of THC or CBD. What's also really interesting is that cannabinoids act on human beings because human beings have receptors that are specifically suited toward these substances, and this is referred to as the endocannabinoid system. In other words, all of us have receptors in our nervous system and in our peripheral organs that actually are able to pick up and interact with these molecules. Very much the situation with opioids. If you know something about opioids, you also know that we have opioid receptors in the brain. So there are cannabis receptors in your brain. I'm sorry to tell some of you that, maybe you didn't know that. So THC, principal actions are sort of the classic marijuana high. THC acts primarily on the central nervous system. It creates euphoric effects. It creates an appetite stimulant effect. There are also THC receptors in muscle, in the GI tract, and I'm really, really oversimplifying here. Cannabidiol is even more complicated. There are at least 2, probably 3 cannabidiol receptors in the central nervous system and in the peripheral nervous system. Cannabidiol's effects include reduced anxiety. There are receptors in the immune system that appear to reduce inflammation, and there are other effects within the central nervous system. In fact, the diagram of THC and CBD and the other cannabinoids and their interactions with all of the human organ systems, it looks more complicated than the Affordable Care Act diagram. It's very, very complicated, but also kind of cool when you start looking at all of it. The other thing that's important to understand is that when we talk about recreational versus medical marijuana, those terms have no medical meaning. They are really the same plant that is being used by different people for different purposes. Many of the strains that recreational users are purchasing in the dispensary to get high are also being purchased by people in those same dispensaries to treat various medical conditions. And both THC and CBD have medical impacts, and we'll talk about that again in a little bit more. Now, the goal for the recreational user is euphoria, and so they're looking for THC primarily, which has that side effect, and CBD is thought to have less euphoric effects, but it also has an anxiolytic effect, and it has a calming effect, and so many people who are looking for a CNS effect for non-medical purposes, they may want cannabidiol. So it's really complicated, and THC is probably involved in pain relief. And so it may not be possible to think about divorcing that euphoric property of marijuana from some of the other therapeutic properties. It may not be quite that simple. So important to recognize those things. Now, last year there was a really good study that came out. The National Academy did a very extensive review of the state of the science for cannabis. And I am going to summarize a 450-page book in one slide. And I'll do my best, but what they found was there is substantial evidence of benefit from cannabis in the treatment of chronic pain and in the treatment of nausea and vomiting for chemotherapy. There are also tantalizing bits of evidence, which they characterize as limited to moderate evidence for benefit in the treatment of anxiety, in the treatment of sleep loss, in the treatment of weight loss for patients with HIV/AIDS, and a number of other conditions that I'm not going to go into here because this is a short talk, hopefully. But one of the things that's happened this year that's also of interest is the Scientific Advisory Panel for the FDA has recommended approval for a cannabidiol-based substance for the treatment of pediatric seizures. So this will be one of the first, actually, cannabis derivatives that will actually go through FDA approval. And it does work. Those of you who saw the CNN documentary probably saw some nice stuff on this. So it's pretty interesting. So why don't we know more? I mean, it's kind of embarrassing, really. But it can kind of be broken down into 3 main reasons. First of all, this is a Schedule I drug. And what Schedule I means is that the FDA does not believe that cannabis has any medical value whatsoever. And that means that only researchers are supposed to be able to look at it, and even then with difficulty, because you have to get a lot of permits, and they really don't want researchers looking at this very much. From an academic perspective, it's not really going to advance your career very much if you are working on the deadly scourge that drags our children into the quagmire of degradation. Probably not going to get tenure if you have that on your resume. So that's been a disincentive. And then lastly, and this is actually very, very important, the requirement from the FDA is that researchers must use the only approved strain that is grown by the USDA in greenhouses in Mississippi. And this strain is vastly different from what you can buy in a dispensary in Colorado or Oakland, California, or anywhere else where you can legally purchase marijuana. The marijuana available right now is far more potent and has many different THC and CBD components than what the USDA research strain contains. And this is actually a problem because you can do research with the USDA strain and come to very different conclusions than someone who is using a dispensary strain might come to. So not a very satisfactory situation. So what about work-related injuries? Well, we've talked about chronic pain a little bit. It's clearly beneficial for chronic pain. Now, I don't want to get into a chronic pain discussion. Many of you may know that I am interested in the treatment of chronic pain. Drug treatment of chronic pain in the long term is probably not effective. It's still a passive treatment. It's probably less dangerous than opioids, but it's still a passive treatment. No one is going to get up off the couch and go back to work taking cannabis. But it's probably better than overdosing on opioids. It's a useful treatment for anxiety. It may have some value for spinal cord injuries, and the possible treatments in PTSD, in traumatic brain injury, have been proposed. It may have value. We don't really know. The research is pretty inconclusive. From the employer's perspective and from the work comp perspective, I think it's also really important to note that cannabis is not the primary treatment for anything in workers' compensation. There are recommended and better treatments. There are guideline-endorsed treatments for all of these conditions. Cannabis at this point, at best, is an adjunct. But it may be a useful adjunct, and I think that's important to keep in mind. The other issue that is very important for the workplace are the euphoric and other side effects. It's going to be very difficult to go back and work a forklift if you're high, and your employer doesn't want you there. And I think that this is indeed a real problem for work-related injuries. You know, safety is going to be a primary concern. And in addition to the impairment of reflexes and judgment, there is also an impairment of cognition and some other things, and there are some carryover effects. There is some evidence that if you use cannabis over the weekend, you may still have some impairment on Monday morning, not unlike some other popular substances. So even though there is, what is interesting is that the National Academy Review was not able to find any good studies that showed that there was a statistical association between cannabis use and occupational injury. And that's surprising, I think, but they were not able to find good studies. Now, that said, they wanted to point out that there is a clear concern. I mean, we know that there is a statistical association between cannabis use and road traffic accidents, for example. So this is definitely not recommended for workplace use. There are multiple legal issues. And one of the difficulties, of course, is it's very difficult to design workplace policies when it's legal by state law, illegal under federal law. People are using it. You're not really sure what you're supposed to do as an employer. And I'm not here to give anybody legal advice, but that is a real concern in a state where it is legal, such as Colorado, and there is a lot of use. Just to give you some perspective on that, here's some data from Colorado. This is happening now. This is a CDC study, and they asked people if they had used cannabis in the last 30 days. So you figure there's probably some underreporting here. These are probably minimal numbers. This is how much workers are using cannabis in different job types over the last 30 days. And I mean, you can draw a couple of conclusions. One is if your refrigerator repair is unsuccessful in Colorado, you know why. And the second is that management seems to like to use cannabis just as much as everyone else. So I'm not necessarily endorsing this, but I think this is a real important societal perspective to have, that this stuff is out there and it's being used, and these people are going to work. So it's something that we're going to have to deal with. Well, I want to keep moving here because we want to talk about opioids a little bit. And I think the important thing about opioids is that there are two potential beneficial impacts from cannabis. And one is that it may be a useful adjunct to other pain treatments. And this is what Raji had alluded to a little bit with the lead-in. If you're using cannabis, might you use less opioid? And then secondly, there's, again, some tantalizing research evidence that cannabidiol and possibly some other components may be useful as an adjunct in the management of opioid addiction. So let's explore that just briefly a little bit more. The RAND Corporation did a study a few years back in which they observed that mortality was lower in states that had legalized medical marijuana. I'm sorry, and I mean mortality from opioid overdose specifically was lower in those states. So David and Ashley Bradford, a father and daughter team from the University of Georgia, have done a series of analyses of public data, starting with Medicare, but also including Medicaid data. And this is a really nice body of work because they have been able to show consistent reductions in opioid prescriptions for Medicare and Medicaid patients in states where marijuana is legal. And some of you may have seen Dr. Bradford talk about this at the WCRI meeting this year. What's interesting is that they show reductions in many of the conditions that the National Academy indicated marijuana may have some efficacy for. So there were some reductions in prescriptions for anxiety. There were reductions in prescriptions for depression. And most significantly, there were large reductions in pain prescriptions. The Bradfords have continued their work, and the real interesting observation that as a physician I think is very compelling is there is a suggestion that mortality from opioid overdose, the same conclusion that the RAND folks came to, mortality from opioid overdose may be lower in these states where marijuana is legal. And that is huge. Reducing mortality from opioid overdose, that is huge. And there are also some cost savings there too. Nothing wrong with cost savings. But I want to focus on the mortality piece. So what about the addiction behaviors? Well, we have less human data here. Oh, and let me also mention that the Bradford stuff is epidemiologic data. It is not a cause and effect kind of situation. We don't absolutely know from epidemiology data. Many of you all are actuaries, so you will understand that. We don't absolutely know that this is going to have this effect, but the epidemiologic association is very strong. Unfortunately, there's less data for the addictive behavior stuff. It's mostly animal data, and here we come back to that Schedule I problem again. It is very difficult to do research on a Schedule I drug. And Dr. Hurd at Mount Sinai in New York is one of the few people who's actually beginning to try to do this. But the suggestion is that cannabidiol may actually help people with weaning from opioid addiction. Hey, worth a try. So where is this going? Well, we're going to need more studies. And I think, fortunately, we're going to have more studies because I think there has been enough publicity about this now. I think people are really beginning to get behind the interest level to see, well, we really need to find out whether this stuff works or whether it doesn't. We need a definitive answer. The public is convinced that cannabis should be permitted in a whole variety of contexts. And I think the most logical thing is going to be to move this from Schedule I to Schedule II, or possibly 3 or 4, so that it may be legally prescribed by physicians in many more contexts, and it will open up the box so that we can do more research and really get some answers to things. This is a Quinnipiac poll from this year. 58% of voters support legalization of marijuana, and younger voters, of course, support legalization at an even higher rate. 91% of the US population supports legalization of medical marijuana. Try and find me a larger consensus on almost any other topic. My God. So it's really interesting. And in opposition to the Justice Department, 70% oppose enforcement of federal laws in states such as Colorado, Maine, Rhode Island, others that have legalized marijuana in some form or another. So we have some interesting public policy decisions to make here. And we have some polarization. I would say, it's fair to say, on that issue on the congressional level. So whether there is a conversation between Attorney General Sessions and Senator Schumer will perhaps define what will occur over the next couple of years on the federal level, but we will see. So just to kind of wrap this up, we really know shockingly little. I mean, it's really, this drug has been used on and off for 4,000 years. We really ought to know more, and fortunately, I think we will. There is really good evidence of benefit from cannabis for a variety of conditions. We really need to define that better, but I think that we will with the right studies. The public is solidly behind this, which I think is important. It means that the first two bullets are probably going to happen. And I think from the employer and the policy point of view, you're really going to need to stay tuned, because this is going to evolve. There are going to be more changes in the law. There are going to be continued challenges in the workplace because of the side effects, because of the euphoria, because this is yet another drug that produces potential impairment. Employers are really going to need to stay on top of this, and we're going to have some real serious conversations about the risks and the benefits, because we want to understand the harms as well as the good stuff. I've been talking a lot about the good stuff, but there are some potential societal harms too, and we want to stay on top of that as well.